Alrighty. Hi, everyone, and welcome to our training this afternoon. Today, we have Disability Rights California here to talk about social recreation services available through your regional center. First, for anyone who's new here, we want to briefly talk about the FRC and what we do here in San Mateo County. The FRC of San Mateo County serves families who have children with disabilities between the ages 0 to 22. We are staffed by parents and caregivers of children and young adults with disabilities, and we provide support, information, resources, and referrals to navigate the systems. We also offer online trainings, support groups, a resource binder, and a monthly e-newsletter. We are funded in part by the Department of Developmental Services, DDS, as well as the California Department of Education under the Special Education Division. I want to give a disclaimer that the FRC is not a legal firm or legal services agency, and we cannot provide any legal advice. Any information provided by us should not be considered a means of taking the place of legal advice that must be obtained through an attorney. With that, we invite you all to connect with us, and we'll put our contact information in the chat. Next, we want to go over some general housekeeping items to make sure our training runs smoothly this afternoon. As mentioned, we will be recording this training to make available on our FRC video library. So we ask that you please mute yourself when not speaking to avoid any background noise, and please be respectful throughout this training. Today's training will be presented in English, and we are offering this training in Spanish on Wednesday. And I'll put that registration link for you in the chat. We are offering live automated captions today, so if you'd like to view the captions, you can go to your Zoom settings bar, find the CC icon, and then click to show captions. We'll do a Q&A portion at the end of the presentation. During this time, you can use the chat box or the raise hand feature to come off mute and ask your question aloud. During this time, we encourage you to refrain from sharing any detailed information to protect your privacy. After this training, we'll be sending out 2 surveys, one for us, the FRC, and then one for DRC, to collect your feedback on how this training went. Our surveys are anonymous and help us understand how to improve our trainings, and most importantly, allow us to continue providing these trainings for you all. And last, we'll be sending a follow-up email tomorrow with the materials and links shared today. And I'll turn it over to Raymond from Disability Rights. Thank you, everyone.
Good afternoon, and thank you, FRC, for having us here again today. And thank you for all the participants for being here this afternoon. My name is Raymond. I am an advocate with Disability Rights California, and I want to give you a quick overview of Disability Rights California and who we are and what we do before we get started. So DRC, we are a statewide nonprofit agency, and we provide free legal services to people with disabilities, with any disability-related issues. So we have attorneys and advocates that work on different subject matters, such as access or discrimination with housing, transportation, education, which includes special education and higher education. We can also help with employment reasonable accommodation issues, public health benefits such as Medi-Cal, in-home support services, or social security overpayment issue that relates to work. And within our agency, we have different programs, such as our Office of Client Rights Advocacy. They specialize in helping clients of the regional center, and our Client Assistance Program, and they specialize in helping clients of the Department of Rehabilitation. So today we have 2 presenters. We have Maria Uriarte, one of our senior attorneys, and Emily Ikuta, one of our staff attorneys. So before we get started, if you'd like to meet with one of our advocates, have a one-on-one appointment, feel free to give us a call. Our number is 800-776-5746, and our phones are open Mondays, Tuesdays, Thursdays, and Fridays from 9 to 3. If you call us outside those hours, you can leave us a message, and our advocates will get in touch with you as soon as possible. So without further ado, let's get started. Thank you.
Thank you, Raymond. Thank you, everyone, for being here today. We are going to be talking about social rec and camping. We're going to provide a history of social rec and camping, explain some relatively recent changes. The changes have been around for a little while, and we're going to go ahead and explain those changes to you. What's the purpose of social rec and camping? Well, it's to socialize so that consumers can meet others and build community. When I refer to a consumer, I'm referring to a client of the regional center, to exercise and to find their passion. That's all it's about. So these are samples, real life examples of what we've heard regional centers respond when a consumer has asked for a social rec activity or activities. So in one case, Maria asked for, Maria, the mother asked for camping for her daughter, and the regional center told Maria that they could only pay $100 a month and the rest had to be paid out of pocket. Pepe asked for gym, karate classes, self defense, and swimming. And the regional center said to Pepe, "That's great. You have to choose one." Jose wants to attend ballet folklorico classes, and the regional center says it has a policy that in order for them to pay, he has to give up some of his respite hours. And lastly, Elena requests horseback riding lessons to strengthen her core muscles and because she loves animals. And the regional center said no because they fund social recreation for socialization purposes only. So when you revisit these examples, after we provide you what the changes have been and what social rec and camping mean, you're going to realize the responses that the regional center gave these consumers, the responses were incorrect. So in July of 2023, social rec and camping came back. It used to be a service that regional centers offered, and I'll talk a little bit in the next slide about the history. If you want to look at the law as it refers to social rec, camping, art, dancing, music, etc., you've got a link here that will take you directly to the law. That's section 4866.2 of the Welfare and Institutions Code. There are a set of codes that are referred to as the Lanterman Act. It's a set of state laws that establish and govern the way regional centers operate. And it's only available in California. So if you move out of state, you'll have to find out what kinds of services are offered in that state. So a little bit of history. There is a DD, a Developmental Disability Bill of Rights in the law, and social rec and exercise are enshrined in the Bill of Rights. And so in 2009, up until 2009, social rec existed as a service. I'm just going to say social rec because I don't want to have to say the others, but you understand that I mean not only social rec but also the other services that are under the umbrella. So because of budget cuts, the service was suspended. Of course, suspension had a negative effect on everyone, including people of underserved communities. So communities pushed for the funding to be restored. And finally, in the summer of 2021, the suspension was lifted, but it didn't say how to implement. And so problems arose that needed to be fixed. What were those problems? Well, there were purchase of service disparities. What do we mean by that? Purchase of service disparities means it refers to differences in the amount of money that is spent on services for different groups of individuals with developmental disabilities. The disparities can be seen across various demographics, including race, ethnicity, age, and disability type. So in the umbrella of social rec, there were purchase of service disparities. Some groups were getting more than others. And we have something that's called zip code roulette. So depending on what regional center you have, that regional center will have its own purchase of service standards and policies. Um, every regional center has its own purchase of service policies with regard to many services, including social rec. There were also shortage of providers. You know, we had these service. It was suspended for many years. The service gets reinstated, but where are the providers, right? So that whole network sort of was lost when the services were suspended. And so it's going to take time to get those providers back. And also a tendency to provide services in segregated settings. And as we know, segregated does not mean equal. So changes, we're going to start talking about the changes that happen. So the intent of the law is to make sure that social rec are, are accessed by many consumers, but especially for children, people who have experienced disparities in regional center services, and those who can't afford to pay for a service up front and get reimbursed. So, so the law says that the regional center can't use barriers to limit access. So one of the things that has been happening, more so when social rec came back, but probably still does, is that some consumers would go to the service coordinator and say, I want social rec. And so the service coordinator would say, oh, you've got to go and exhaust in-home supported services, IHSS, using it as if it were a generic resource for social rec. And if you have IHSS, you know for a fact that IHSS is not a generic resource for social rec. Two very different kinds of services. Okay. So the other thing is that the regional center can't require people to exchange a service. For example, we had heard of regional centers saying, oh, if you want social rec, then you have to give up some of your respite or another service in order to get the social rec. Cannot happen, should not be happening. The other thing that regional centers have used to it's really a barrier to access, really, of the service, is require families to pay a copay or otherwise share costs of social rec in order to receive them. The law doesn't say that. There are some services that do require some, participation, as you see here, but not social rec. And under the Lanterman Act, the only people who can decide whether social rec should have a copay or not is our legislature, and they haven't done it. So now I'm going to pass it on to Emily, who's going to continue talking about the changes.
Thanks, Maria. So just continuing on as to the changes with the purpose of increasing access to social recreation services. And these were kinds of issues where it varied by regional center, but there were real examples of people getting affected where their policies were very arbitrary and it was not clear which and how regional centers were enforcing these restrictions. So with a lot of effort from DRC and other advocacy organizations that drove this drove this additional clarification, this reform to the law to make social recreation more accessible. So another really important change was social recreation being what is called what could be categorized as a participant-directed service. Now, okay, what does that mean? How does that affect me? Is that important? It's important because it goes to how one gets reimbursed or pays off the provider of that social recreation activity. So consumers, you or your child, can choose to go through a regional center. You could go through a regional center vendor, someone vendored and contracted already with the regional center, if they have one, or you can choose someone who is not a vendor with the regional center, as a lot of social recreation organizations or even single person types of setups are, and still get them reimbursed or paid off by the regional center through something like this participant directed service setup. So let's say you have a child and you identify this really great person who provides swimming lessons, and she is specifically has that background in helping provide swimming lessons to children who have developmental disabilities. And she just started her thing off the ground. She's already got a little handful of students that she's teaching, and you're thinking, can I get this person to provide swimming lessons for my child? I mean, she doesn't even, she has no relationship with the regional center. How can they pay her off? Yes, they can. And it would be through this participant directed setup using what is called an FMS, Financial Management Service. For those of you in this presentation who have heard FMS before in the self-determination program context, SCP, just to be clear, this is not like limited to SDP. FMS is the kind of agency where they're in SDP, but they also play a role in social recreation. But I'm not talking about SDP. We're just talking about social recreation. And this applies whether you're an SDP or not. I just want to clear that up because there have been people who they hear FMS and they, were familiar with the term, but with SDP got confused and were wondering if we were talking about something that was restricted to that whole SDP thing and not applying generally to regional center services. Oh, thank you, Maria. Yes, SDP, self-determination program. And the whole purpose of this was understand regional centers being aware that there were no vendors when the services got restored. Well, during that whole period of time where there was with a service where they couldn't pay for social recreation, there was no contracted vendors because there was, they weren't allowed to pay them off for social recreation. Now it's become available. Recently, they have actually created contracts and, vendored with various agencies. I've known regional centers that had them with like horse therapy or horse riding. But for the most part, they had to deal with the fact that they were not vendored and just couldn't go through the timely and frustrating process of having to vendorize with every single social recreation service provider that families had identified. So this was a way around it, how you could pay them off without actually being vendored with the regional center, which is a big deal because with every other service from the regional center, unless you're an SDP, again, that's the last time I'm mentioning SDP, with every other service, the agency has to be contracted, has to be vendored with the regional center. So they specifically created an exception for social recreation. Now, that being said, there are still barriers that we want you to be aware of. And the more you know, the more you know how to challenge or work your way around these potential barriers. So one of the barriers is purchase of service policies, or POS for short. So remember when I said like one of the frustrating issues when social recreation got when it was returned, when regional centers could pay for it, that different regional centers were starting to have policies where some of them were like very restrictive, like, oh, you can't have any more, if it's over $100 per month, or you can't have more than one type of activity in one quarter. And it's like, where does that say in the law? Where are these policies coming from? And a lot of time regional centers were just individually releasing policies that made it really confusing to get some consistency of like, okay, what's the limit? What's the restrictions on these social rec? And that's still a problem. Yes, we did there have been changes in the law that we just talked about in the previous slide, specifically for that address those challenges. Nonetheless, there's still a potential barrier. So we just want you to be aware of that, but also learn how to challenge it and be prepared to encounter it as you, if you are prepared to encounter it. So examples are, and again, these were real life examples that we specifically pushed back on and told the legislature to add those reforms in the law, requiring families to give up services in exchange for social recreation. Oh, you want like 10 hours of swimming classes per month? Well, you're going to have to give up 10 hours of respite services, even though respite is a completely different service that was given for a specific purpose, not related to social recreation. They were doing that. And we were like, no, you shouldn't do that. You can't do it. And we made it so the law changed. They can't do it now. But again, there still might be ways that there still might be ways, who knows, about how they can find their way around that. Limiting the number of hours or the number of services. Like, oh, well, if you're going to get social recreation, it can be no more than this number of hours across the board, or it can't be this many uh, number of the actual social rec themselves. Like, oh, you want swimming and boxing for your kid, your child? You only have to pick. You gotta pick one. So those are also policies where there are barriers, but they're not bound or tied specifically to what the law says. The law just says social recreation has been restored. You do have to exhaust generic resources. That's pretty much the extent of it. Also, those recent reforms specifying what the regional centers can't do. So, so if you have a child who would very much benefit from not just one, but two social recreation activities. If you've done what you could to find, a more affordable generic resource and it's just not there. If your child needs these number of hours where they could develop their social skills and get to a level where they are more comfortable in social settings, you could push back on its policies and be like, okay, give me your policy in writing. Also, give me your. I also want to know: is this your formal decision that you're not going to grant this because of that policy? So again, always be aware that you can push back, demand something in writing, demand explanations of like, okay, why are you applying this? We understand, but my child specifically would benefit from this amount or this number of services. Why apply it across the board like that when it's supposed to be an individual based analysis, individual program plan. So just letting you know these potential challenges and what you can do about them.
Emily, can I just interject here?
Yeah, sorry.
And talk about a real life example. So there was a client that we represented who was asking for 5 different activities from his regional center. And the regional center said, no, you only have $100 to spend on social rec a month. So we filed for hearing, we went to mediation. We had 2 sessions with the mediator. He was actually really great. And what ended up happening is that the client got the 5 social rec services that he wanted, including transportation to some of those rec services, because the regional center knew that they were doing wrong, right? And they really didn't have an argument for under the law for limiting, social rec to $100 a month. So, if you come across if your regional centers is limiting your access to social rec, appeal, ask for an informal conference, ask for mediation, because the stats are really good for people who, the stats are good in the sense that people who go to an informal conference and mediation do resolve their matters. There are good numbers on that, on resolution at those stages before going to hearing. So I just wanted to talk about a real life example. Thank you, Emily.
No, thank you for jumping in. I mean, like, that's a fantastic outcome. And we have a whole presentation like just on appeals and complaints and stuff, which we have utilized when in pushing back and advocating for clients who encountered policies like this. So we just want to be aware, like as a strategy, as a tactic that you guys can use to, again, put the pressure on the regional center. Be like, okay, regional center, you're going to say no. Well, then you're going to have to really, be prepared to justify your denial. And if I might drag you to mediation, to informal meeting, maybe even a hearing, and regional centers put them in a position where like, oh, is this really worth it? Trying to justify this denial. So again, the tactic, and we could have a whole presentation about that, but just want to let you know at least that option, and as another way to put up that challenge when you encounter these kinds of arbitrary barriers to service or to certain services. Another barrier, and this is unfortunately something that is more of a broader systemic problem beyond what the regional centers do. So, and I mentioned it in the previous slide. So there was a long period where service, the because of budget cuts and lack of funding, regional centers straight up were instructed and required under the law not to provide, not to pay for social recreation. There were exceptions, like really specific exceptions where it's like, they absolutely needed this type of activity to address symptoms of their developmental disability and such. But outside of those exceptions, generally it was no paying for social recreation. So since that was in place in the law, well, there was anyone or any agency that was providing those services just kind of went away. Either they of course they ended their contracts, they no longer had a relationship with the regional center, or they just and a lot of them no longer even exist. It was also just a different setup back then of like what was available versus what's available now. So there was no providers, no agencies. So regional centers were like, and guess what? One of the things that regional centers were required to do was be vendored, contracted, have like a specific relationship, documented relationship with an agency. There is a vendorization process, but it takes time. It's kind of there's a lot of paperwork that has to be filled out and such, and that's assuming the agency is willing to go through all of that. So you have a service that came back, but no vendored providers because it just came back. So what to do? Not enough supply of vendors to meet the demand for services. Problems getting existing providers of social recreation and camping to become vendors. Because like I said, it was a frustrating process. That single person, self-employed social rec swimming instructor would be like, do I really want to fill out all this paperwork just for this one student? This one, person who even though they would really much benefit, is putting a lot of drag on me, on my availability. So vendorization process, like I said, was difficult, bureaucratic, took too long to be worth it for a lot of organizations that were just like, I don't think we're going to be suitable for your child if we have to go through all of this red tape just to get paid by the regional center. So that was a big barrier. So sorry, I was like, wait, which slide are we on?
Sorry, no. It's hard to move sometimes. Sorry, everyone. It's me.
And so continuing off of the payment issues. So what the regional centers had set up, and many of them actually are still doing, is they would be like, okay, we'll pay off this specific service provider that you've identified, but it's kind of like a reimbursement. Okay, give us all the proof, the invoices, etc., and we'll eventually pay them back. So pay their vendors weeks, maybe even months after the vendor submit an invoice. So when they're like, oh, here's a fee for me to provide swimming instructions for your child for that week. It's like, wait, I have to wait a week. I have to wait several weeks to even months just to get paid back. And again, for each and every week. So I have to wait that long to get the money from the regional center to pay me off. Again, me being the service provider perspective. But most social recreation providers don't work this way. To sign up for, signing up for a class or activity, most of them are like, you have to pay up front. Like, oh, hey, you want to enroll your child in this summer camp and get a spot there? Okay, you got to pay up front right now. They're not going to be like, okay, yeah, we'll wait for weeks or months for the regional center to eventually pay you and then you to pay us or us back for this activity. Regional centers had no system set up to be able to pay providers upfront in this way. All their payments were set up to pay after services had been provided, not before. Which is a huge, which was all the more pressure on those families who could least afford it, who could even just paying upfront was put them in a very difficult financial position. At many regional centers, the only way was for the parents to front the money and then get reimbursed. Then once they got reimbursed, then they pay back the service provider, or they just like go put themselves basically, in the red, and they themselves get paid back. This created an equity problem. Many people just straight up can't afford to do that. So what to do? So how does that new law address these barriers? So it prohibits three of the most significant, clearly inappropriate restrictions that regional centers were placing on social recreation and camping. Again, based off of real life examples we were observing and we were very strongly and vocally protesting about. So it makes the legislature's vision and intention for social recreation and camping clear. Access should be wide and broad and not restricted and narrow, especially for children and especially as to those who would benefit from those services and addresses their developmental disability. Just to be clear, social recreation applies to adults as well as children. So this is not a age limited kind of service. So as for the payment issue, going back to participant-directed services allows the regional centers to pay providers who aren't vendored, who aren't contracted. They don't have to require them to be vendored. Instead, actually pay them off directly, and to do so before the activities start, not after they're concluded, and not weeks or even months after that service has already been provided. Steps for success. So these are just kind of general tips, ways that you can, in making that request for social recreation for your child, what to be aware of, what kind of the checklist of things that you could jot down as you are making your case for regional center. Are you going to, we want this activity for my child. It would greatly benefit them social wise. Are you going to approve it or not? So why are you asking for this service? What need would this service address? And what benefit are you hoping to get out of the service? Will it help you or your child to accomplish one or more goals in the current individual program plan? This is really important. So making this request, not only it would be crucial to either tie that request to something in your child's IPP, or if there is no goal in your child's IPP, there's no outcome, no goal, no objective, set up and request that be added to the IPP, and then use that to follow up with, therefore, I'm asking for this service because now there's this goal that this service is crucial for my child to meet. So really important to line up that social recreation, tie it to some outcome or goal. If there is no outcome or goal, try to get that outcome or goal in there in the IPP, because goals and outcomes can be added, revised, and changed. If yes, how? If no, amend the IPP to make a strong case for the need. What does the purchase of service policy say about social recreation and camping? So again, going back to the purchase of service policies, and to give you a heads up, every regional center, every one of the 21 regional centers have posted publicly available policies that go into social recreation. Those policies, and so that's why you can kind of use that to get a heads up of like, okay, is this regional center, are they putting limits on the number of social recreation services? Are they putting a limit on the hours? So I'll know that they may bring this up as a challenge, and I can address that. Like Maria said, when they advocated for that client and getting more social rec activities. each regional center, that being said, each regional center has their own website. Their websites are like kind of structured in their own way. So you do have to do some searching around to find the purchase of service policies. But if that's too much trouble, just ask your service coordinator straight up. Like you don't even have to have an IPP meeting first. Just like, hey, could you give me your written confirmed social recreation and camping policies, please, so I can review them. So just let you know that if you can't find it yourself on their websites, you have a right to it from the service coordinator to get those in writing. In writing, I want to emphasize, because sometimes I would not be surprised, and I've seen it where they may have their own unwritten policies that put limits on social rec. So I'm like, okay, if it's I don't see it in the ones you publicly posted, is it in writing? If it is, give it to me. So just again, like there might be additional barriers they're going to put in place. In that case, you can push back and be like, okay, where's it in writing? And again, even if it's in writing, that doesn't mean the policy is fair or appropriate. But it also means, like, are they adding additional barriers that they have to justify? So what does this purchase of service policy say about the social rec, about the camping? Does it match with the new changes in the law that prohibit regional centers from, like we went over, having to pay a share of cost, having to go through IHSS before as a generic resource, even though that does not apply, or having to swap social rec and get rid of other hours of services? Is it consistent with the legislative intent for these services to be made widely available to consumers, not only for socialization, but to lead the lives they want in the community? So that's another way of like, look, this policy, especially if they're applying it across the board, like they're not even looking at person by person. They're just saying, doesn't matter who you are. We're not going to authorize this number or this amount or this type of service. Be like, does that sound like that's in line with what the law says about these services being individual based and widely available? So just ways that you could push back if necessary if you encounter these kinds of barriers. More steps for success. So going off that checklist of how to generally prepare, and we're using real life, we're using like examples here, but examples based off of real life client interactions and stories from those clients who were trying to get those services from the regional center. So first, explaining it, why and what service that your child needs. Your daughter loves to dance. You have noticed that when she's dancing, it's easier for your daughter to talk and interact with her non-disabled peers. Otherwise, in other contexts, it's really hard for her to connect with other people, other children. You explain this to your service coordinator and emphasize how much dance really helps your daughter open up and make friends in a way that she hasn't been able to do before. So again, that kind of explanation, that kind of that picture actually really helps to set up like, look, I'm not just saying, oh, dancing would be nice for her. It's no, I know she would, that my child would greatly benefit from this. And also, it doesn't have to be something where you've seen them do it before. You could be like, look, they haven't done this service before, but because of the nature of it, or because a child has already expressed a strong interest, I believe that they would very much benefit from this activity. So just want to be clear, this is not limited to activities that they've already done before. Just like ones that you have a strong sense that they would greatly benefit them individually. Explaining and showing. You can also show that the regional center purchase of service policy says they fund social recreation for socialization purposes. You could pull out her individual program plan and note that socialization and what is one of her goals. Like an example, an outcome of a goal would be, so my child would want to interact with peers and make more friends, something like that. Even something as broad as that can be used to tie to a service. She has been taking a social skills class to help learn to socialize, but it hasn't been a good opportunity to use or practice those skills in a community with non-disabled peers. And finally, request. You set it up, you've explained it, and now regional center, I am requesting that you pay for my daughter's dance class. which would be perfect to meet this IPP goal if the goal is already in there. Are you going to approve it or not? One thing I really want to emphasize, I don't know if it's in the later slides, so I'll bring it up now. One of the other limitations that people were encountering was regional centers saying, oh, is this social recreation one-to-one, or is it like in a community setting? Because even if it was an activity where the overall goal was to build up their skill to be more comfortable in a public, in a socialization setting, regional centers were like, look, if it's one-to-one, no go. We're not going to pay for it. That changed. So it turns out the DDS, the DDS being the Department of Developmental Services, they're the ones who tell the regional centers and clarify, what they should do, said, no, a one-to-one type of social rec activity is permissible if the long-term goal is developing their comfort and ability to interact with others. Great example, and I actually had a client who had one-to-one lessons where we pushed back and got the regional center to pay for it, was one-to-one swimming lessons. Because we were like, this individual has specific developmental disabilities. He needs to learn how he just really wants to interact with other children like him at these pool get-togethers, but he doesn't know how to swim. It's not just about like learning how to interact with others. It's also learning how to swim safely. And we were like, look, in order for him to comfortably interact and engage in these, in these pool activities, in these pool games, he needs to learn how to swim first and foremost. And he needs one-to-one attention for that, So we were like, look, regional center, we want you to pay for one-to-one swimming lessons. And then once he gets a comfortable level of experience with that, then seeing like how other ways to open up his ability to interact with other children at the pool. And the regional center was like, oh no, that's one-to-one. We can't pay for that. And we we're like, no, that's not a restriction that is tied to the law. It is permitted. And then DDS released that their orders, their directives saying, no, yeah, it doesn't have to be one-to-one. And the regional center changed, and they changed their mind, and they paid for the swimming lessons. So I really want to emphasize that because that's another thing. Even for a social recreation activity, it's not something where there's an explicit bar. If it's not like, if the lesson and the activity itself is not in a public integrated setting. If the long-term goal overall is to help your child or help you develop more social skills and interact more comfortably with others. So what's next? And I mentioned this before, DDS directives to the regional centers. So DDS, Department of Developmental Services, they are that big state agency. They control, they monitor the funding the money that goes to the 21 regional centers. They also release directives being orders to the regional centers. And the reason they do that is in many, a lot of situations where regional centers are encountering a situation where they're not sure what to do, or there's a recent change in the law, but it's like, okay, it's one thing when for the law to, be changed. What does that mean in practice? What do we have to do? Like, what do we have to do, the regional centers, and how do we do it in a consistent way where one regional center isn't doing something completely different from another regional center and causing chaos? More chaos than it already is with the regional center system. So the DDS was there to release these directives saying like, okay, the law recently got changed. So regional centers, this is what you do. And that was why I brought up that directive where it said, oh yeah, you can pay for one-to-one social recreation activities, because that was the DDS was compelled to clarify that because regional centers were it was like really inconsistent how regional centers were approaching that issue. And also about interpreting the law. Like, okay, social rec has been restored. What does that mean? Practically, what do we have to do? So these DDS directives are important for that reason. And in fact, I'll put it in the chat too of some of the most relevant ones that actually touch on the very things that we've discussed during this PowerPoint. Regional center revision to policies. So regional centers, they are, as the more as following these reforms of the law and also the directives from DDS, regional centers, they have to engage in the community, get a sense of like, okay, what's working, what isn't, what are the biggest issues that families are still having. There's got to be some level of community engagement and input, and then revising the policies as needed to make them more accessible. Because when regional centers draft their policies, they actually have to run it by DDS. So all the more that they have to make sure that those policies are going to get approved. Vendorization, that is going to be an ongoing thing. Now, of course, with social recreation being a participant-directed service, that shouldn't be a big issue. And regional centers are now increased. Now that it's been several years out since it got restored, regional centers are actually creating more and more contracts with various social recreation vendors. So even if it is creating more options for families where regional centers may already have a list of like social rec that could actually greatly benefit you and your child. It shouldn't be that hard. Process need to be made as easy as possible. So vendorization, if there is vendorization, can be fairly straightforward and not this big, long bureaucratic process. And participant-directed services, what are the next steps? And I'll go over that in the following slide. Oh, wait, sorry. I guess the following steps were, I just talked about it. Participant-directed services are, and I'll go to give more clarification. So if you, and this is something we've been hearing, that even now is still an ongoing problem. If sorry, if there's social, if the participant directed service, if there's an issue of like, look, I need to pay for a spot in this camp that's happening in the summer, but I need to pay it off right now. How do I get the regional? But the regional center is saying like, oh, sorry, we only got like a reimbursement thing. You could just pay it off, out of pocket, give us the invoice and, we'll pay you back. And it's like, I can't, and you're like, I can't afford this, or I can't keep doing this. So be aware that you can inform the regional center of like, look, regional centers, there's a process called participant directed services where you can pay off, you can set something up where you can pay off this, this social rec camp or others directly. And how that would be done is they have a financial management service, FMS. The financial management service are themselves a service provider, but they're a service provider whose whole purpose is to pay service providers. Basically, like my job is that regional center gives me money and I give the money to this provider. So it's like a service provider whose whole purpose is that service providers get paid. So regional center, they have, they actually do already have a vendor contracted list of FMSs and be like, FMS, this parent, consumer, they've got this activity and they need to pay up front. That's required. And they just can't go through the whole reimbursement process. Let's set something up where we pay you and you pay off the service provider. You pay off that swimming instructor directly. And FMS like, okay, we'll do that. And so they set it up, and that's way they can pay off the service provider directly without having to go through this really timely, frustrating reimbursement process. So I'm just letting you know that if you are encountering that challenge, push back with that. Like regional centers, the law and directives from DDS say that this is something that you can and should pay upfront, especially for those who can't afford it. So where do you not like? Where's your FMS? Where's that agency that can help pay off this activity straight upfront? And what if? And are you still going to say no? Put it in writing. Are you going to deny this? I would treat that as effectively a denial. It's not. I think regional centers try to get around that as an admin thing, and I'm like, no, I'll treat it as a denial. Put that in writing so I can challenge it more formally. So just letting you know how you could push back as to that. And that said, though, I do remember I did have a client though where the regional center was like, look, we're actually trying to work. The regional center's response was like, we're trying to find an FMS to contract with. We haven't been able to find one. But we just found one that's interested and that we can have a contract with. So is it okay? So we're going to have to keep doing the whole reimbursement thing, but we'll let you know as soon as we get this off the ground and blah, blah, blah. And I believe they did. So they actually were genuinely trying to work something out where they could get these FMSs involved and use them to pay off your service providers directly. But again, that's something that regional centers should actively be doing and should have been doing ever since these reforms to the law. So if they're, they shouldn't be at a place where they're like, don't know what you're talking about and aren't able to actively act on that. If you tell them like, yes, there is a process for directly paying off the provider where I don't have to shoulder that cost.
Yeah, Emily, I wanted to add, we haven't mentioned an important tool when the regional center is imposing access barriers to social rec, or, still saying, no, we don't have that FMS that'll pay directly. You're going to still have to get reimbursed. You can file what is called a 4731 complaint. And we have a manual called the Rights Under the Lanterman Act manual on our website under resources. And we have chapter 6, I think that's chapter 6, that talks about, or maybe I'm confusing it with our special education rights and responsibilities manual. But in the manual, it talks about 4731 complaints. You're going to file those directly with the director of the regional center. That person has a set number of days to respond. If you're not happy with the response, you can file a 4731 complaint directly with the Department of Developmental Services director. So, so you could be filing, if they're violating your rights, violating the law, a 4731 complaint, and in some instances also go to hearing because they're essentially denying the service, like Emily mentioned earlier. Okay.
So it looks like we reached the end. So
Yes, this is our intake line. So if you have specific questions about a particular case, we would ask that you contact our intake line. And how this works is that you'll talk to an advocate, and all of the intakes that we get, for example, that are regional center related, are reviewed by our IDD practice group made up of attorneys and advocates. And so your matter will be reviewed at the very least, and you will get a response at the very least. So that's our intake line. And so we are going to go ahead and turn off the recording, and we're happy to answer questions.
Recording really. Okay, that concludes our training. Thank you everyone for your questions and your engagement. Thank you so much to the Disability Rights California team, Maria, Emily, Lonnie, and Raymond. And as a reminder, we will be sending out a follow-up email tomorrow with the PowerPoint as well as all of the links shared in the chat. So yeah, look out for that email tomorrow. And have a great evening, everyone. Thank you.
Thank you. Bye. Thank you, Emily.
have a good night,
Raymond,
everyone.
Lonnie.
Thanks, Maria.
Bye-bye. Thanks, everyone.